There are two kinds of underfunded plans. One is an underfunded pension plan, and the other one's an underfunded retiree healthcare plan. Underfunded healthcare plans are, in most states, typically legally binding, absent of bankruptcy. And remember, bankruptcy law only provides Chapter 9 bankruptcy provisions for cities, not for states. But an underfunded pension plan, you kind of have no choice. You have to make good on. An underfunded retiree healthcare plan is different. The judiciary has allowed states and cities to change those plans, change the copays, change deductibles, change the coverage rules. And over the last, let's say, 10 years, a lot of municipalities have scaled back on the terms and conditions of those retiree healthcare plans for public sector workers. And we've seen the net present value of those obligations coming down. So when you're looking at states and cities at the overall unfunded amount, what matters is what's the split between your unfunded pensions and your unfunded retiree healthcare. And, for example, let's just look at New Jersey. In New Jersey, of all of their unfunded problem, and is severe, 60% is pension related, but 40% is retiree healthcare related, which means they have some flexibility to adjust those terms and conditions. Illinois is almost 90% of the underfundedness is pension related. So even the flexibility to try to adjust these numbers is much more constrained because it's much more of a pension problem than it is a retiree healthcare problem.
And our Constitution has said that you cannot change these pensions under any circumstance.
And to ratchet that up, in Chicago, 95% of the problem is related to pensions and not retiree healthcare. Whereas if you look at a city like New York City, maybe only around, it's split 50-50. So in every way that you try to cut the numbers, it seems like the challenges are greater in Chicago and the state of Illinois.
I want to hear you also explain that what we're currently doing isn't even enough to fully solve the problem, right? Like the city and the state must get more.
Right. So I think the policies at the state and the city level are meant to avoid very politically challenging and controversial restructurings of any obligations or anything like that. But the funding ratios of these plans are going to remain extremely low, and they're going to have to continue to rob Peter to pay Paul and shift spending and taxation towards this system and away from other things. So I think that's what we're looking at here over the next, at least the next 7 to 10 years. And if the demographics happen to get worse, then that obviously that makes the challenges worse as well.
How about the numbers for if the city or the state decided to ramp up? And how much more revenue would they need?
Yeah, we talked about that. One of the things you could do, no municipal entity has done this as far as I know, but on paper, one of the things that in principle that a pension plan could do to deal with an unfunded situation is to have the active workers increase their contributions, not just to fund their own retirements, but to finance the unfunded retirements of people that have already retired. The problem is in Chicago and Illinois, that would require something like 180% to 270% increase in active worker contributions. And you can understand why that would be a very difficult pill to swallow. And so, again, we really haven't seen any municipal entities using active worker contributions as a meaningful way of solving these problems.